These are our learning objectives for the session. And now we move directly to the session. So AI is reshaping traditional assessment methods in transformative ways. Educators and learners are turning towards AI to enhance objectivity and effectiveness of assessment processes. Integrating AI into assessment holds the promise of a more personalized and adaptive approach to evaluating individuals. So, designing MCQs, essay type questions, and OSCEs using different AI tools. Developing MCQs that align with the educational goal requires a deep understanding of subject matter as well as awareness of the potential pitfalls associated with poorly constructed MCQs. So, if we give one prompt into ChatGPT, it will start doing the work for us. But we will have to use the same Bloom taxonomy: C1 remembering, C2 understanding, C3 applying, C4 analyzing, C5 evaluating, and C6 creating. And MCQ prompt on, for example, acute abdomen. For C1, you will develop an MCQ asking student to recall the key signs and symptoms of acute appendicitis. In understanding level, you will modify, develop a MCQ that requires student to explain the difference between visceral and somatic abdominal pain and acute abdomen. In applying C3 level, develop MCQ asking student to apply their knowledge by choosing the most appropriate diagnostic test for a patient presenting with right lower quadrant pain and suspected appendicitis. In C4 analysis level, you will give the prompt, develop MCQ that requires students to analyze a clinical case with symptoms of acute abdomen and determine which organ system is most likely affected based on the pattern of symptoms. In evaluating C5, you will give prompt as develop an MCQ asking student to evaluate different management options for a patient with acute cholecystitis and select the best treatment based on current guidelines. In creating C6, develop an MCQ encouraging student to design a management plan for a patient with acute abdomen caused by perforated peptic ulcer, justifying their choice based on clinical evidence. So these are the different ways to give prompts for different levels of Bloom taxonomy, which we are all already familiar with the Bloom taxonomy. So you go to Socrative.com and create an account while you are creating MCQs. And there are common technical item flaws like test wiseness, grammatical cues, logical cues, word repeats, longest option is always correct, absolute terms, implausible distractors, convergence, all of the above and none of the above are test wiseness like things, and often students lead to the right answer by using these clues. Irrelevant difficulty is by vague terms, poor sequence in the numerical data, unnecessary information, unclear or ambiguous information, and more than one or no correct answer, and it may fail the hand cover test, and it may have negatives not except in the term. Negatives other than except word may be there as well. So these are the different problems with item construction. Other than Socrative, Google Forms can be used as a quick quiz app. Quizlet.com is another one, but most features are behind paywall. Turnitin can auto grade as well. Short answer question with marking key prompt. Develop a short answer question that requires students to apply their knowledge of the diagnosis and initial management of patient presenting with acute abdomen. Ensure the question includes the clinical scenario and ask the student to justify their management decision based on clinical evidence. Also provide a marking grade. So this is the prompt for a SAQ with marking key. It is the standard prompt. For ASCII, the standard prompt is different. Design an objective structured clinical examination station that requires students to obtain informed consent from a patient diagnosed with gallstones who require a cholecystectomy. Ensure the OSCE involves communication skill, explanation of procedure, potential risk, and addressing patient concerns. Also include marking sheet, instruction for the candidate, examiner, and simulated patient. So these are the references from where this was taken, and that is all about creating assessment. And this is the beautiful picture of our Khyber Medical University, where all the knowledge flows.